Here's a summary of our 2-minute TikTok CPD session. So this is covering my own article, which I posted a couple of weeks ago, which is called Measuring What Matters, Mastering Serial Testing in Chronic Pain. Now, I put it in the context of chronic pain, but this here could be in the context of any long-term rehab and recovery process, and it's just to do what are the things that we need to do with our objective measures that we're taking to ensure that we're meeting client where they're at and keeping them engaged in the process, so that way they're continuing to work with us to achieve their goals. So, one of the first things that we need to think about here from a philosophical level is what is serial testing, okay? And serial testing is just tracking of certain objective measures over time, all right? So then we've got to think about what actually is an objective measure and why would we check it over time? Well, quite often we think of objective measures as a static kind of process or a static result that we measure at a point in time, and that means exactly that the person is at this level. However, what objective measures actually show us is this little fitness fatigue paradigm type of thing here, where for any particular objective that we're taking at any time, there's going to be a certain amount of fitness or readiness or like positives for that objective measure, and there's going to be a certain amount of fatigue or pain or other things that get in the way of that objective measure, and then the performance on that objective measure is going to be an outcome of the both of those. So therefore, what this article is asking us to do is to just continually measure particular important objectives over time to see where someone is sitting at that kind of fitness fatigue paradigm balance, to be able to help educate them on how their context changes and how their performance changes in different and varying contexts. Now, why we would do this? The next thing that we want to get into a vocabulary is all of this FECSE, which is the part of the theory of consumption value, right? People will come and keep seeing you if they feel that it's functional because it relates to their meeting their needs. You meet some emotive needs of theirs. It's conditional on a cost benefit analysis, okay? And cost is more than just money, it's time, it's opportunity, etc. Social, that you have kind of a street cred, your reputation and your service has a reputation to deliver the functional results that they want. And epistemological, that they are interested, it sparks curiosity in them, okay? I wonder what my test results will show this week. That's that education part. So this was the crux of the article, to say that in coming up with the tests that we're wanting to do for someone, these are the overlapping areas that if we can get one or two tests that get all of these areas in it, you're going to have the best outcomes with continuing your patients on a long-term journey. Okay, so we want something that has clear, coherent messaging, all right? We want something that has objective data and norms to compare to, and we want things that matter to the patient, okay? If we can have one test that covers all of those, that's awesome. But if not, we're going to probably want to get little bits from each circle to make sure that we're covering. So in the middle, we have ideal serial testing. In this little overlap of objective data and matters to the patient, we have patient-reported outcome measures. In this one little bit of clear, coherent messaging and matters to the patient, we might have movement experiments and experiments with doing things differently in their environment. And for here, the overlap of objective data and clear and coherent messaging, we might have performance/clinical outcome measures. So then how this looks in regard to, say, a back pain case example, our clear and coherent message would be, I want to show you your back is/can become resilient. Our objective normative data are going to be measures that indicate the back status and capacity, and things that matter to the patient, or say the patient was worried that their back was too fragile to be able to pick up their child. So therefore, what we're going to try to do is choose some tests that are going to meet all those criteria. So we want things that are going to show them how resilient their back is, that actually have clear measures of their capacity and show them that in relation to being able to pick up their child, right? So here we're going to go through, and we've chosen something like an isometric mid-thigh pull, something like some neurodynamics, so the isometric mid-thigh pull to show them how strong their back is compared to the weight of their child. Something like neurodynamics to show them that their nerves, that a clear and coherent message that they're not going to damage their nerves. So if we can track their neurodynamics and their neurological assessment over time, we're showing them that even with pain, that their nerves that they're worried about aren't getting any worse. So that there is just how we would put that all together. Now, how do we do this for serial testing? Well, because we know that that fitness fatigue paradigm is true, well, then we know that at different points in their life, their performance in any one of those tests is going to be different, right? And we know that with anything chronic or long term, that this is going to change quite a lot over the course. So what we're looking at is booking them relatively frequently and seeing them relatively frequently and coming up with a testing battery that we're wanting to go, hey, every, once a week we're going to test one of these things, and then every 4 weeks we're going to test another one of these things. So once a week in a chronic pain thing, we might do an isometric mid-thigh pull, and we'll talk about how when you're fatigued or when you have a heightened amount of pain, that your body is protecting you from producing as much force, and so your numbers are lower. But the trend over time is that our low numbers are getting higher and our high numbers are getting higher. So you're going to continually test those same tests, whether they're feeling good, bad, or indifferent, and you're going to use that as an education piece to show them that their performance changes depending on their fitness or depending on their context. You'll also choose maybe like once every 4 weeks to do that like neurological examination, okay, where you go, actually, if you have a look at it, even though you've had lots of like pain flare-ups and your isometric mid-thigh pull has been lower than normal lately, if you have a look, all of your nerve testing is still completely fine, showing that you're not actually doing damage to nerves in your back, okay? So it's making sure that you're setting some sort of testing framework and that you're keeping to it and that you're using this fitness fatigue and performance paradigm to be able to educate a patient or educate a client on their performance in the context of this serial testing to go, hey, objective measures change over time, and what we care about is how these track over time as an educational piece to show you about your condition and managing it better yourself. Cheers, guys.